Welcome, everyone, to the OphthoKnight quiz show, the ultimate interactive challenge for ophthalmologists from around the world. Test your knowledge, compete, and win. Every week, we go live with a fast-paced, high-energy ophthalmology quiz. You'll face real clinical scenarios, rapid spot diagnoses, and investigative decision-making, putting your practical ophthalmology skills to the ultimate test. Compete against ophthalmologists worldwide in a quiz that's fast, challenging, and fully interactive. Here's how it works. Answer in the comments using only the number 1, 2, 3, or 4. Only one answer per question counts. Multiple submissions will be disqualified. Answer quickly. Don't wait for the full question to be read. The winner is the one with the most correct and fastest answers. Over the past weeks, hundreds of outstanding ophthalmologists have joined our quiz. Here are some of our brilliant winners. Look at those scores. Incredible work. And heartfelt congratulations to our champions. Maybe next time, it'll be you. Winners also receive a symbolic gift, but the real reward is sharpening your ophthalmology skills and competing with the very best. Are you ready to take the challenge? Subscribe to OphthoKnight, join the live quiz, and maybe your name will be the next on our winners board. We go live every Friday at 11:30 p.m. Cairo time. To join, simply subscribe, turn on notifications, and be ready when the quiz begins. All you need is your knowledge and your speed. Join us live and see if you have what it takes to become the next OphthoKnight champion.
Welcome to our live trivia show. Get ready to test your knowledge and have some fun. Today's topic is ophthalmology, the fascinating field that explores everything about the eyes, from corneal diseases to retinal disorders, glaucoma, and beyond. We'll dive into 25 exciting questions. Each one has 4 answer options, only one is correct. The faster you answer, the more points you earn. To play, simply comment the number of the correct answer or type the full answer. It's that easy. Eyes may be the window to the soul, but today, they're your gateway to victory. Remember, 25 questions, 4 options, speed matters. Here comes question 1 of 25. Let's get those brains blinking. Salzmann's nodular degeneration is most commonly associated with which of the following? 1. Viral keratitis. 2. Trachoma and flectingular keratitis. 3. Recurrent corneal erosions. 4. Congenital corneal dystrophies. Type the number or full answer. Don't blink, just think. Salzmann's nodular degeneration often presents as bluish-white corneal nodules, quite distinctive. Correct answer, trachoma and flectingular keratitis. 19 got it right. Great job, everyone. Shout out to Dana, Ahmed, Yasser, Waima. Avellino dystrophy is inherited and worsens after LASIK. Important to remember. Correct answer, discrete crumb-like deposits, lattice lines. 30 of 34 players nailed it. Impressive. Shout out, Ahmed, Dana, Abrar, Reem, well done. Here comes question 3, ready to test your medical memory? Hutchinson's triad is seen in 1. Vitamin A deficiency. 2. Measles keratitis. 3. Congenital syphilis. 4. Congenital rubella. Think fast, triads tell powerful diagnostic stories in medicine. Hutchinson's teeth are notched, peg-shaped incisors, classic diagnostic clue. Correct answer, congenital syphilis, great diagnostic recall. 34 of 35 players got it right. Bravo Ahmed, Asma, Fatma, Dr. Shima. Time for question 4, neonatal eyes, big clues. Which ophthalmia neonatorum appears days 5 to 14? 1. Hertz V. 2. Gonococcal. 3. Chlamydial. 4. Chemical. Clock's ticking, think timing, transmission, and typical clinical signs. Chlamydial conjunctivitis often includes eyelid swelling and watery to mucopurulent discharge. Correct answer, chlamydial. Well done, sharp-eyed players. 7 of 36 got it exactly right. Kudos Ahmed, Mawada, Ahmed Yasser. Question 5. Let's focus on pediatric eye anatomy. A 7-year-old presents with lid malposition. 1. Tarsal kink syndrome. 2. Epiblepharon. 3. Congenital entropion. 4. Centurion syndrome. Look closely, medial canthal tendon clues might help. Centurion syndrome often features a prominent nasal fold and eyelid malposition. Correct answer, Centurion syndrome. Great diagnostic thinking. 22 of 32 players nailed it. Bravo Ahmed, Sarah, Shireen, and Miriam. Question 6. Time to flex those ocular muscle facts. Which muscle is most involved in myositis? 1. Superior rectus. 2. Superior oblique. 3. Medial rectus. 4. Lateral rectus. Think anatomy. Which one swells up most often? Orbital myositis often presents with pain, diplopia, and restricted eye movement. Correct answer, medial rectus. Well done, everyone. 20 of 35 players answered correctly. Shout out, Shima, Asma, Mariam, Muhammad, brilliant. Question 7. Let's zoom in on orbital varices. What's the hallmark clinical feature here? 1. Sudden painful ptosis with fever. 2. Pulsatile ptosis, audible brute, exertion worsens. 3. Morning ptosis, improves during day. 4. Intermittent ptosis, worsens with Valsalva. Think carefully, this one's a classic presentation. Orbital varices are rare venous malformations, often triggered by Valsalva maneuvers. Correct answer, intermittent ptosis with Valsalva maneuver. 29 of 36 players got it right. Bravo Ahmed, Mohammed, Mariam, and El Nokali. Question 8. Let's test your lacrimal gland knowledge. A young adult presents with bluish, translucent swelling in the upper fornix. What's the most likely diagnosis? 1. Dermoid cyst. 2. Dacryops. 3. Dacryocele. 4. Conjunctival inclusion cyst. Think anatomy, think location, choose your answer wisely. Dacryops often results from ductal obstruction in the lacrimal gland. Rare but distinctive. Correct answer is dacryops. Well done all. 28 of 36 players answered correctly. Shout out to Waima, Miriam, Shireen, Ahmed. Question 9. Let's zoom into systemic links with lens issues. Which condition causes supratemporal lens subluxation? 1. Weill-Marchesani syndrome. 2. Marfan syndrome. 3. Homocystinuria. 4. Ehlers-Danlos syndrome. Think connective tissue clues, locking your answers now. Marfan syndrome often affects the eyes, heart, and connective tissue significantly. Fascinating condition. Correct answer is Marfan syndrome. Great job. 35 of 37 players got it right. Shout out to Reem, Hoda, Dana, Muhammad. Question 10. Let's talk cataract surgery technique. During needle decompression in intumescent cataract, the preferred needle bevel orientation is 1. Either orientation is not important. 2. Bevel up. 3. Bevel sideways. 4. Bevel down. Precision matters. Choose wisely and lock in your answers now. Bevel orientation affects fluid release and capsule safety during decompression. Tiny angle, big impact. Correct answer is bevel down. Well done. 27 of 39 players answered correctly. Shout out to Miriam, Ahmed, Dodi, Mohammed. Question 11. Let's talk capsular tension rings. The key advantage of a modified CTR over a standard CTR is 1. Prevents posterior capsule opacification. 2. Expands capsular bag circumference. 3. Centers IOL and mild zonular weakness. 4. Allows scleral fixation and severe zonular loss. Think carefully. Modified tools often solve complex surgical challenges. Lock in your answers now. Modified CTRs are often used in complex cataract cases with zonular instability. Correct answer, scleral fixation and zonular loss. 26 of 39 players got it. Well done Miriam, Ahmed, Asma, Sarah. Question 12. Let's dive into pediatric ophthalmology. Newborn with central corneal opacity plus iridocorneal adhesions. The most likely diagnosis is 1. Sclerocornea. 2. Peters anomaly. 3. CHED. 4. Axenfeld-Rieger. Think carefully, these congenital clues point to something specific. Lock in your answers now. Peters anomaly involves central corneal opacity with lens corneal adhesions. Rare but important. Correct answer, Peters anomaly, well spotted, everyone. 37 of 41 players answered correctly. Shout out to Waima, Ahmed, Fawzia, Mariam. Question 13 coming in, let's test that glaucoma knowledge. Malignant glaucoma is characterized by 1. Shallow AC plus normal IOP after trauma. 2. Shallow AC plus high IOP after filtering surgery. 3. Deep AC plus low IOP after cataract surgery. 4. Deep AC plus high IOP after angle closure. Tricky terminology here. Choose wisely and lock in your answers now. Malignant glaucoma is also called aqueous misdirection, rare but serious condition. Correct answer, shallow AC, high IOP, well done. 39 of 42 players got it right. Shout out, Ahmed Zayedi, Nasser, Fatma, Nagham. Question 14 now, surgical minds, this one's for you. The most common route of intraoperative application of MMC during trabeculectomy is 1. Subconjunctival with soaked sponge. 2. Subtenons injection. 3. Intravitreal injection. 4. Intracameral bolus. Think like a surgeon, pick your technique and lock it in now. Mitomycin C helps reduce scarring after glaucoma filtering surgeries like trabeculectomy. Correct answer, subconjunctival with soaked sponge, excellent. 37 of 40 players answered correctly, impressive. Shout out, Ezra, Dr. Shima, Ahmed, Reem. Question 15 coming in, let's keep that momentum going strong. The term sweating in encapsulated bleb refers to 1. Mucus secretion from goblet cells. 2. Conjunctival chemosis from inflammation. 3. Aqueous percolation through thick bleb wall without obvious leak. 4. Aqueous overfiltration causing hypotony. Eyes on the prize, lock in your answers now, glaucoma gurus. Encapsulated blebs may form weeks after trabeculectomy, affecting pressure control. Correct answer, aqueous percolation through thick bleb wall. 16 of 38 players answered correctly, well done. Congrats Sarah, Dodi, Fatma, Mohammed, great job. Question 16 now. Keep those brains buzzing, you're doing great. A child presents with generalized ichthyosis since infancy, spastic diplegia, and delayed milestones. Most likely diagnosis? 1. Tay-Sachs disease. 2. Sjogren-Larsen syndrome. 3. Refsum disease. 4. Niemann-Pick disease. Think carefully, neurologic signs plus skin findings might guide you. Sjogren-Larsen syndrome includes ichthyosis, spasticity, and intellectual disability from early childhood. Correct answer, Sjogren-Larsen syndrome. Tough one. Only 3 of 34 players got it. Fawzia, Sarah, Mahmood, brilliant diagnostic thinking. Question 17, eyes on the prize, folks. Patient has night blindness, peripheral loss, shimmering retinal crystals. 1. Stargardt disease with flecks. 2. Retinitis pigmentosa with crystalline deposits. 3. Biaty crystalline dystrophy. 4. Adult onset foveomacular vitelliform dystrophy. Retinal sparkle isn't always pretty, choose wisely, vision detectives. Biaty crystalline dystrophy often linked to CYP4V2 gene mutations, rare but distinctive. Correct answer, biaty crystalline dystrophy. Well done. 29 of 38 players nailed it. Shout out, Ahmed, Hoda, Sarah, Anas, brilliant. Question 18. Time to flex those retinal reflexes. A 72-year-old with neovascular AMD shows hemorrhages, cystoid spaces, and leakage progression. 1. Retinal artery macroaneurysm. 2. Retinal angiomatous proliferation. 3. Polypoidal choroidal vasculopathy. 4. Classic CNVM. Intraretinal to subretinal, what's your diagnosis? Lock in those answers now. Retinal angiomatous proliferation often begins intraretinally, progressing to subretinal neovascularization. Correct answer, retinal angiomatous proliferation. Impressive. Only 4 of 36 got it right. Bravo Hoda, Ahmed, Mahmood, Mohammed, great job. Question 19, let's dive into another retinal mystery. A 25-year-old man, recurrent vitreous hemorrhages, bilateral. Peripheral nonperfusion, neovascularization, positive TB workup. What's your diagnosis? 1. Sickle cell retinopathy. 2. Proliferative diabetic retinopathy. 3. Peripheral retinal vein occlusion. 4. Eales disease. Think carefully, this one's a classic case. Lock in answers now. Eales disease often affects young adults and is linked to tuberculosis exposure. Correct answer, Eales disease. Well done, everyone. 29 of 33 players answered correctly, impressive. Shout out to Miriam, Fawzia, Anas, Fatma. Question 20. Let's talk about intraocular gases and their staying power. Which gas lasts longest inside the eye? 1. SF6. 2. Perfluorocarbon liquid. 3. C3F8. 4. Air. Think buoyancy and duration. Choose wisely. Answers locking in soon. C3F8 gas can remain in the eye for up to 55 days. Correct answer is C3F8. Great job! 30 of 33 players answered correctly. Amazing. Shout out to Abrar, Miriam, Ahmed, Fawzia. Question 21. Let's talk iris pearls and eye conditions. Which condition are they linked to? 1. Tubercular uveitis. 2. Sarcoid uveitis. 3. Lepromatous leprosy. 4. Fuchs heterochromic iridocyclitis. Eyes on the prize, lock in your answers now. Iris pearls are small white nodules seen on the iris surface. Correct answer, lepromatous leprosy. Well done, everyone. 26 of 34 players got it right. Shout out to Nagam, Ahmed, Dr. Shima. Question 22. Let's dive into a clinical mystery. Fever, headache, red eyes after fresh water. 1. Whipple's disease. 2. Ocular onchocerciasis. 3. Lyme disease. 4. Leptospirosis. Think fast. Your diagnosis skills are being tested now. Leptospirosis is often transmitted through water contaminated by animal urine. Stay cautious. Correct answer, leptospirosis. A tricky one indeed. Only 7 of 33 answered correctly. Kudos to Sarah, Mahmood, Mohammed, Ahmed. Question 23. Eye doctors, this one's for you. What's typically absent in POHS? 1. Vitreous inflammation. 2. Punched out chorioretinal scars. 3. Parapapillary atrophy. 4. CNVM. Think carefully, POHS can be sneaky in presentation. Histoplasma capsulatum is a fungus often linked to POHS cases. Stay sharp. Correct answer, vitreous inflammation. Well done, everyone. 24 of 32 players answered correctly. Shout out to Anas, Ahmed, Nagam, Fawzia. Question 24. Let's talk strabismus and high myopia. Which procedure is commonly used? 1. Superior oblique tuck. 2. Standard recession resection. 3. Loop myopexy of SR and LR. 4. Inferior oblique myectomy. Think carefully, ocular muscles can surprise even seasoned surgeons. Heavy eye syndrome often causes esotropia due to muscle displacement. Fascinating, right? Correct answer, loop myopexy of SR, LR. 24 of 34 players answered correctly. Well done Ezra, Miriam, Ahmed. Final question, number 25. Let's finish strong, everyone. The Lancaster red-green test is used to 1. Test color vision. 2. Quantify angle of deviation using prisms. 3. Detect latent squint. 4. Assess horizontal, vertical, and torsional deviations. Eyes on the prize, choose your answer wisely now. Lancaster test uses red-green goggles to map eye muscle function precisely. Correct answer, assess horizontal, vertical, torsional deviations. 21 of 34 players answered correctly. Great job Mohammed, Ahmad, Ahmed, Shireen. Ahmed Yasser tops the leaderboard with 24 correct answers. Brilliant performance. 48 players joined the fun. Huge congrats to Mahmoud, Mohammed, Hiba, Anas, and everyone else. Thanks for playing. See you next time.